national disease control programs, but yet we have productivity loss. Lastly, Nigeria has research institutes like the National Veterinary Research Institute, but yet we have limited access in remote communities. To tell you that the private sector is very important, these are the evidence that will give you a hint. For the last mile initiative, increased veterinary medicine registration was by 86%, while the trained local animal health workers strengthened supply to remote pastoral communities. As for the Nigeria Access model, young veterinary enterprises partnered with pharmaceutical companies and the National Veterinary Research Institute to expand the last mile delivery and by increasing the foot and mouth disease vaccine distribution, which increased from 53,000 to 85,000, which gives a positive impact. Now, we need to reason this. The government alone cannot scale vaccination coverage. The government provides policy regulation, disease surveillance, national coordination, and quality assurance. How can the private sector complement this? The private sector can complement this by investing. They invest by including finances into the government national coordination finance input to make sure that vaccines are produced in high quality and high quantity. Innovations. So here's the thing. Most vaccines are created in large dose vials, number one. Number two, these vaccines cannot reach small-scale farmers. And as a result of that, where does the private sector come in? The private sector can innovate small dose vials to enable these small-scale livestock farmers to be able to afford vaccines. Another way is creating multivalent vaccines. Multivalent vaccines that contain multivalent vaccines to enable that, for instance, if an animal is meant to be given 1 meal of, let's say, for instance, PPR, what if a multivalent vaccine is created? The multivalent vaccine has pestle-the-petit ruminant, it has sheeppox, and it also has contagious caprine pleuropneumonia vaccine, just in one vial. This is innovation. Veterinary services. The government feel overwhelmed when it comes to mass vaccination. Then why not the private sector come in to assist the government? For cold chain logistics, there can be innovative ways to create and ensure that the cold chain remains stable and to ensure that vaccines remain viable. How do the private sector scale vaccination coverage? They can manufacture quality and affordable vaccines. They can strengthen cold chain logistics and improve vaccination packaging. They can partner in government vaccination campaign, like I said earlier. These government veterinarians become overwhelmed at times when it comes to mass vaccination. They can also educate farmers on awareness on endemic disease and behavioral changes, because most farmers have mindset that vaccines have negative impacts on their animal. They can develop digital vaccination records. Most Nigerian large-scale farmers are pastoralists. Why not create digital vaccination record where these farmers can be tracked through their routes where they take their animals to graze, and if it's time to give the vaccine, they contact the farmers and they reach them and administer this vaccine. Lastly, it expands livestock insurance and innovative financing. Now, we go to the strategic recommendation. The strategic recommendation cannot just be alone. It has to move with policy, because obviously the private sector has to collaborate with the government. They have to improve finance mechanism for livestock vaccination, strengthen supportive policy and regulatory framework, expand digital vaccination record and disease surveillance, promote farmers' education and community awareness, invest in cold chain infrastructure and logistics, and lastly, support private veterinary practices in undeserved areas. This, all in all, gives a higher vaccination coverage. Lastly, what is our expected impact? When collaboration occurs and when the private sector comes into this, there is increased vaccination coverage, which reduces cost and wastage. There is reduced disease outbreak, which causes the livestock to be healthier. Then there is improved productivity. Improved productivity leads to increased farmers' confidence and participation in administering vaccines to their livestock. Then there is improved food security, obviously because the livestock are healthy and there is improved productivity. And lastly, economic growth. Everyone is fine and happy. Here are my key takeaways. Vaccines alone do not control disease. High vaccination coverage is what protects livestock population. The private sector is indispensable to sustainable vaccination system. It expands access, improves efficiency, and supports sustainable vaccination system. Collaboration is the way forward. Thank you very much.
Thank you very much, Asia Umisalauddin. Very nice piece of presentation. Now, question time for the presenter. 3 questions, please. 1, 2, and okay, Prof. So you pass first. You pass to Prof. Then whenever you collect, you ask.
Thank you, Chairman. It's a nice presentation, and I know it will do better if we have more opportunity. But I have just a question for you. We know that aspect of demand and supply is the key to what brings in private sector interest. It's not like the government that are compelled to use interventions. There must be something that will attract the private sector into the system to help in, because they have also a target. So my question to you is, this is a chain of so many activities. If you are to start as a private practitioner, where are you starting from? Thank you.
Okay, you can ask your question.
Thank you very much. That's a wonderful presentation. I'm Ahmadu, President of IKORE. So my question is about the policy. It's easier to bring so much innovation from the government side when it comes to private and public partnership. So what do you think the government need to do better to make sure that every piece of livestock that go to abattoir is being vaccinated? Think through that we can have a data. From that, we can stop the farmers from, it's mandatory for them to vaccinate before they even take it to abattoir. Thank you.
Good morning. My name is Ahmadu. I'm a 400 student. My question is, from your presentation, there was one of the challenges you said is affordability for the farmers, and some can actually afford the vaccine. So now, you said now the private sectors will have to improve that, they invest, which means if they are investing, they are putting money. Whenever they put money, they will expect returns, like profit. So now, don't you think that could also be a challenge, because it will increase the price of the vaccines, and then the farmers, some will not be able to afford due to that increase in cost. Thank you.
Yes. Don't you think private sector participation will improve the price of the vaccine?
Thank you so much for your questions. The first question was, if I'm to start a private practice, if I'm to start as a private practitioner, where am I starting from? Honestly, I'm going to start from creating multivalent vaccines because I think it is very economical, number one. Number two, it will be created in a single vial, which will enable farmers buy them without having to buy individual vaccines. So that's my answer. The second question was, what does the government,
What do you think the
government
government
would do better?
for cattle to be vaccinated?
So what I think the government should do better is to honestly collaborate with the private sector, because I feel there are some things the private sector have, some advantages they have that the government lack. So this collaboration is the key. And also, when they are about, like he said, when the animals are about to enter the abattoir, what can the government do to ensure that every animal is vaccinated? There would be a record for that. So if the government implements a strict record, like they do now before allowing butchers, from my experience, there are records whereby they give receipts before butchers take these animals to the market. So if there is also a record for approved vaccination, I think that would increase the chances. Lastly, can't investment from the private sector increase the price of vaccination? I feel if the private sector comes with innovative ideas to reduce costs without being at loss, they would sell these vaccines at affordable prices. Thank you.
Thank you very much. Asia Mr. Laudin, very good way of response to the questions. I just want to say something. The last workshop we attended, I am Professor Wakawa. Honestly, there is a real need of the private sector to participate. You recall during the COVID year, 2020, isn't it? Know what happened? The foreign countries, decided to keep their vaccines, both for humans and animals, because they said they didn't know what was going to happen. So if the private sector does not start keying in with government, there will be a day that will run into real crisis in this country. Because the countries argue that let's keep our own. We don't know what is happening. Yes. So we'll take the third presenter, Mohammed Bashir Shehu. Umi, you added 10 seconds. Maybe you transit either in Addis or before coming to Nigeria. You added 10. Okay, go ahead.
Good morning, everyone. Good morning, my lecturers, my co-presenters, and my other colleagues. I am Ahmad Beshishu, a 600 level student. I'm standing here to present you on a solution to a persistent problem. I'm a farmer, I buy animals, I keep them, they fall sick, I either slaughter them or I sell them. Why? Because I'm not sure I'm not sure of preventing diseases on them, or I don't have confidence in the management. That is why we present you a solution that will solve the problem associated with vaccines. Problems associated with vaccines majorly include the weak cold chain, low vaccination coverage in some areas, and also low awareness among farmers, animal owners, and also clinicians. We therefore present a solution in which it is an institution-based solar-powered hub that will serve as a reputable source of vaccines through partnership with institutions, farmers, and field clinicians. The mission of this hub is to improve ruminants and livestock productivity by delivering quality vaccines and ensuring quality and surveillance. After all, we plan to achieve and to become a major player or major provider of quality vaccines with high level of technology integration and community engagement and other collaborations. The plan structurally is to acquire vaccines from repeatable source, then pass it through logistic companies up to the level of our own solar-powered hubs, then from solar-powered hubs to either target or targets directly coming to pick up, all being delivered through the drone. And at the end, we all gather data and we build a surveillance system. This solar-powered hub looks like something like this. It is going to be fully powered by solar. It's going to be located on institutions, majorly veterinary teaching hospitals. Just cite an office there. So it will be providing the institutions with vaccines, and also it will serve as a hub or a hotspot for vaccines to the communities and the neighborhood. We engage through the hub with farmers, with community animal health workers, and other practitioners in the sector. It will act as a micro-enterprise model where it will make its own money and also manage itself. The drone delivery system ensures that the vaccines are delivered within the short period of time possible, thus cutting the time in which the vaccine takes in transit between our hub and the point of delivery, and also have a software for management and also ensure tracking of the data and also building the surveillance system. Communities will be engaged through training of community animal health workers, partnership with private vets and paraprofessionals, and also engaging with students, especially final year students who are about to become field officers, and also who engage with farmers, youths, and other practitioners. There are about 152 million ruminants in Nigeria being reported as such 2021. So this is the market size for the entire country, which has been reported to have a low vaccine coverage. The business model targets farmers, veterinary clinics, paraprofessionals, and veterinarians, and it will make money from vaccine sales and also vaccine delivery. So also, it will spend money only on vaccine restocking, maintenance, staff salary, rentals, and any other thing associated with the business. The business became feasible, looking at the technical aspect, the organizational feasibility, the legal and regulatory framework that involves we are going to ensure we align with all agencies responsible in the sector, including NAFDAC, the institutions we are going to base, and every other member of the regulatory board. There also, it is financially look at we are going to partner 100% with we are going to apply it through partnership, and we also supply partnership with supplying companies. So this is a team. The team composed majorly of 3 major individuals, 2 of which are veterinarians about to graduate, the CEO and the sales intelligence, and then also the CTO, who is a computer scientist and a practitioner on the field. So these are other institutions. We will agree and comply with their own rules and also register with them accordingly. So the pilot roadmap for us to first launch it and see whether it is something that is feasible or viable. We will have a planning stage where we do all the plannings and all the calculations and all the parameters are going to be evaluated. Then we will install the first hub in one of the institutions in the country. Then we will launch it and call on other practitioners to see what we're doing, and then we'll evaluate, and then we'll continue from there. So therefore, I asked this hall for partnership, sponsorship, and mentorship. Thank you for this.
Can I have the mic? Thank you, Mohammed Bashir Shehu. Now, let's have questions for this third presenter. It's from who? Then yes, right. Just one.
Thank you very much. Once again, my name is Professor Bello, Deputy Veterinary Public Mami Bashir. I think your name is not even on the paper. That give us trouble to find out who you are. You see, you cover most of the things I was expected to see. And I so much cherish the way you look at it. When they say private sector, it's about business. That way you should put in your mind. So they want to see how using private sector will scale this. Well, you see on your write-up, it's like you are in a hurry. I like it's not much, but you didn't do some of much of the, in fact, it's better in your presentations, even though you are looking at one angle of solving the problem. But whenever what we are expected, you miss one important thing, that's government policy. When private sectors are coming in, government policy, you have to bring in what will enable environment, government policy will allow private sector to strike. And that's the question I even asked the other person. You have to link it. I've not seen anybody talking about even subsidy, which is very important. I mentioned, but all the stakeholders in your write-ups have seen it. And you are able to link, and the issues, you see when you are making policy, identify the problems. Like we did, we mentioned even the mandatory problems, which affect vaccine delivery. And you guys were not using data. Data have been shown many more that show that mandatory has decreased vaccine delivery significantly. But I have not seen any of you mentioning that as a data, which is a variable information and data. Okay? Then secondly, again, in terms of economic losses as a result of failure of vaccines. But people are not looking at it. This is what the businessman will look at it, how he can tap it. These are very key data that most of you are missing out. Okay? So please, what the question I'm asking, how do you link government policy for enabling these private sectors to come? Thank you, Chair.
Okay. My name is Dr. Adam Sayadi Tijani, one of the organizing team. I enjoyed your presentation, but you cover only one aspect of the whole competition. Yes, even from your title, the title is supposed to rate the topic given to you. You can have a solution, but you kept on hammering on one solution. Yes. Then I have a question. What distance will the drone cover? Yeah, what distance will the drone?
Can it cover from here? If somebody is ordering for vaccine from Lagos, can you still send drone from Zaria?
Then how many years will it take you to achieve a national coverage if you are starting with one hub? Thank you very much.
My name is Muhammad Abubakar Mande. My question to the presenter is, most of the farmers, especially here in the northern Nigeria, are pastoralists, and most of them are not tech-oriented. Also, in most of the villages and where they normally move seasonally, there is no veterinary services or veterinary outpost. So how do you plan to achieve, like, not talking of the delivery now, even to order or request, how do you plan on engaging those farmers in remote areas? Thank you.
Give him that response.
Thank you for your questions. I would like to start from the last question. It's about how to link pastoralists to the platform. Actually, we didn't plan to enroll remote areas directly onto the platform. What we planned was We will link them through the community animal health workers, which we believe time to time they used to have interactions with them, and we believe they used to go at least meet them once in a while, like that. So our own major concern is about the veterinarians and the community animal health workers. That is why even when we are emphasizing on farmers, preferably we're talking about medium and large scale farmers, not actually the pastoralists or the small scale farmers, which some of them are not even educated to use technology. So another question is about how do we achieve national coverage? Okay, for us to achieve national coverage, as I said, the first one we want to launch is just about the pilot. It's just a pilot study to test whether the idea works. It's just like we develop a prototype, then you test it. After all, then you, based on your results, maybe in 1 to 2 years, you evaluate, especially you do 1 year evaluation at least, then you move to other institutions and install. So I can see after within 1 year, we can scale up based on what we have available to move to other institutions. We will start preferably, as I said, with veterinary institutions before we consider the geographical distribution and in each geopolitical zone. And now another question was asked about the distance covered by drone. Okay, the drone depends on the type. We can have the drone that can cover up to 96 kilometers, which is zip line platform. So it can cover up to 96 kilometers. It depends on the one we are able to afford. And some can cover maybe 5 kilometers, some up to 20. It depends on the type. And another question was asked about government linking. Okay, our plan on the government issues, there is the new, based on the new ministry, the livestock economics. There is a new documentary that is the National Livestock Accelerator Program. I can't remember the acronym. So we will use that, and we will look at where it is possible and the opportunities being raised. I can remember what the minister said, that they are actually looking for investors in the vaccination production and also the vaccination activities. That is in the last meeting with the Minister of Federal Livestock Development, and that's 3 months ago.
Thank you, Mohammed Bashir Shehu. Honestly, let me be candid. Mohammed Bashir, I like your presentation. I didn't want to influence the grading of my colleagues, the assessors. But I must say this, from you listened to the comment made by Professor Kabir, the head of the Department of Public Health. You are lazy in writing your article. Let me be frank with you. I like your presentation. Your presentation tells me something that you can go to greater heights. But honestly, it's laziness. That I will say. So we'll take the fourth person, Emmanuel Demita. Because when we look at each other, I turn and look at the assistant dean. He presented 5 minutes, 50 seconds, but the presentation was good. But you see, why did you make use of your time? When you want to compete for something, you need to put your full energy and time, honestly. So, assistant dean.
Yes, I'm set.
Emmanuel Temitao, come on, repeat this, and the assistant dean will time it.
Your time has started now.
The dean, the assistant dean, the panel of judges, co-presenters, fellow students, good afternoon, everyone. My name is Emmanuel Temitao, and I will be presenting on the role of the private sector in scaling ruminant vaccination coverage in Nigeria. As a way of introduction, livestock production is actually a critical pillar of Nigeria's agricultural economy, food security, and of course, rural livelihood. And there was this particular
was this particular study by Zaria in 2019 that showed and proved that small ruminants actually play an essential role in poverty alleviation and asset building as well. Also, productivity and economic potential of this particular sector has been severely undermined by transboundary animal diseases such as CBPP, CCPP, PPR, and etc. But the unfortunate thing is that government-led vaccination campaigns have actually been very insufficient to achieve herd immunity, and this is where the private sector has to come in. They have to be able to bridge the gap between vaccine production and availability, and of course, the last mile delivery. What are the current gaps in ruminant vaccination? The first one is actually logistical bottlenecks, and this is about cold chain deficiencies, as this kind of the nature vaccines, and that leads to loss of farmers' confidence. Also, mobility deficit. Vaccines do not reach remote areas, and this kind of limits vaccination coverage, and that's actually the main topic. The second will be security vulnerabilities. We all know banditry and insurgency is actually a very big factor now. Recently, some animals were carted away from the university farm. It was very, very unfortunate. This actually prevents veterinary officers from traveling into high-risk areas and localities. Moreover, there are also less veterinary officers as compared to the number of ruminants that we actually have. The next is budgetary constraints, erratic state funding. So when a particular government begins a particular project, another one comes in, they tend to just abandon it. And this actually leads to postponed, scaled back, completely cancelled animal vaccination rounds. Also, regulatory bottlenecks. There's actually weak enforcement against counterfeit vaccines. We have vaccines, they will not work, they will be ineffective, and this actually erodes pastoralist confidence, because how do you explain buying vaccines and then not working to pastoralists and small ruminant herders? Also, lengthy regulatory approval processes for vaccine importation. Before you can import vaccines, there are too many bottlenecks here and there, and this actually discourages private pharmaceutical investments. Also, sociocultural barriers. There's this thing with Nigerians, we are kind of more reactive than proactive. It's only when an animal gets sick, they want to take it to the hospital instead of actually preventing the occurrence of this particular disease. Also, low awareness level of ruralists. You know, even the Holy Scriptures make us understand that my people actually perish because they lack knowledge. So this low awareness level, once they don't even know that there are vaccines that could help them, there's no way they are going to do anything. So this actually limits voluntary vaccine uptake by small-scale farmers. They don't know and they can't do anything. Also, strains of agents. Strains of agents is actually a very important one. Different strains of agent renders vaccination ineffective. For example, FMD has about 7 serotypes, and PPR has about 4 lineages. So vaccines are produced against a particular strain. So if those vaccines are actually used against another different strain, then it's going to be ineffective. This also limits voluntary vaccine uptake by small-scale farmers. Now, what is the roles of the private sector? The first one I have identified is commercial distribution. Private sector should invest in localized infrastructure. For example, solar-powered refrigerators, insulated transport boxes, and also temperature loggers. This will prevent breakage in cold chain and, in a way, restore farmers' confidence and establish a foundation for sustainable livestock. Also, sustainable service delivery models. We know the ruralists, where these small ruminants and even large ruminants are, there are no trained workers there. So, and that's why trained community-based animal health workers should be encouraged. These are people that are actually living in the community with the ruralists, with the pastoralists at their domain. So the private sector should kind of train them and encourage them to actually operate on a fee-for-service basis. This will kind of improve their interest and resolve the human resource issues, and also turn vaccination to a self-sustaining enterprise. Also, digital tracking is a very important one. The private sector should employ the use of digital tools and mobile tracking platforms to capture real-time vaccination data and also cold chain compliance. This will prevent localized shortages and target containment strategy. If there is data, information is power. If there is data, even the government will be able to know where there are lapses and will be able to come in. Also, demand creation and behavioral change. This is very, very important. The private sector should be able to create demand for their product through consumer-focused marketing. Also, corporate social responsibility initiatives. They can just identify a particular village, do this initiatives, and that will actually help them. It will foster voluntary and sustained vaccine uptake among household farmers and pastoralists. Now, we all agree with me that only the private sector cannot achieve this, and the government has to be an enabler. And the first on my list is to tackle insecurity. If insecurity is being tackled head-on by the government, then vaccination coverage in Nigeria will actually improve. Also, they should back community-based animal health workers. There should also be aggressive enforcement against counterfeit vaccines. This will improve, this will make even ruralists who want to buy more instead of just, they say it does not work and stuff like that. Now, streamline regulatory procedures such as fast-tracking registration through NAFDAC's portal, and also make provisions for fundings targeted towards ruminant vaccination coverage. There are lessons from the field we can actually get. The first one will be in Kenya. There's this Vital 2 program that was launched in Nairobi on November 15, 2024 by the Directorate of Veterinary Services, GALVmed, and others as well. And on April 22, 2025, there was 3-in-1 combination vaccine protecting against CCP, sheep and goat pox, and also PPR that was actually introduced into Kenya. This actually went a very long way in vaccination coverage in the country. Also in Tanzania, President Samia Suluhu Hassan launched a 5-year national vaccination and education campaign spanning 2024 to 2029. And in that particular period, the president, his administration, provided 700 motorcycles, 4,500 digital tablets to empower field teams, vaccinated over 17 million small ruminants against PPR, and distributed 17.23 million vaccines in October 2025. This actually went a very long way to cover ruminant vaccination program in this particular country, Tanzania. So if they can actually do it through a collaboration of the government and the private sector, then I think Nigeria can also do it. In conclusion, scaling vaccination in Nigeria requires private-public partnerships, commercialized last-mile distribution, digital tracking, and to secure community-led models and regulatory reforms to unlock a sustainable animal health market. We should always know that preventive medicine is always better than curative medicine. Thank you all for listening.
Yes. Thank you, Emmanuel Temitayo, the fourth presenter. Let us now entertain questions. Yes, 1, 2, and 3. Okay, we'll take it as 3. So come on, can you take?
Yes. Sorry.
My name is William Musa. I'm from 311. So, as one of our respected prof say, whenever you are thinking about private sectors, you are thinking about business. So, as we all know, there are some basic economic and problems that we have to look into. One is what to produce, how to produce, and for who to produce. This for who to produce is very, very vital in this sector, because you are dealing with people that are less literate and pastoralists, that they are not living let's say in a single environment. They are always moving. So almost all the presenters did not provide a clear solution or a clear way by which these private sectors can play a vital role in educating, enlightening, and making awareness to these target people, so that they know the importance of this vaccination, and they can even look for the vaccination before you say you are going to take it to them. Thank you. So my question to this presenter is, how can you solve this problem, or how can a private sector play a vital role in educating and enlightening about this vaccination? Thank you.
Thank you very much. Thank you, the second person.
Thank you, Chairman. I remain Jibril Adamu, a colleague. Just recently, I was waiting for vaccine for research purpose, and I sent out to my colleagues, and then I couldn't get that particular vaccine because it's out of stock. And then the information I got is that there is a source, but it's not reliable. And I asked this simple question: why not reliable? They said, what is happening now in the market? We buy the vaccines to sell. And if they are not selling and some vaccines are out of stock, they change the levels. They change the levels so that they make their sales. As far as I'm concerned, they want to make profit. They don't want to lose anything. So meaning that it is another angle that we are not looking at. So we have to be very careful in understanding that we are in a country that is different. And we have to behave in a way that is smarter than where things are ordinarily accepted. So my worry up to now is, for example, let me cite an example. Because the rural population, they know the value of their phone, they need it to be charged. So whether there's electricity or not electricity, you'll find at the most remote area somebody that is making money by just charging phones.
Yes. Yeah.
And nobody needs to advertise to you because you know the need. You go and patronize that person. The key here is, especially, I wanted to ask my student here with the drone as well. The key is, we are taking our ruminant to be vaccinated. We don't have much problem mostly with poultry vaccination as much as ruminant vaccination. And the key issue is even lack of awareness. That is one, and so many other things. So those are the challenges that we want to see how the private sector will come in. With your own thinking, you can make us, propose for us how this thing can be solved. That is what we're looking at. So my question to you is still on demand and supply. Because even if you want to supply those vaccines and they are not in demand, among the actors, if you are going to be a private bacteria practitioner, how do you fit in to make sure that your own will be different? And you are able to get those vaccines and they will be patronized. Thank you.
Yeah, I still remain Adams Oyadetijani. I enjoy your presentation, especially linking all the models together. You're able to strategize on all the models and put the vaccination. However, towards the end of your presentation, all those information you are giving us, you really research on the side of government. Make sure, right? So you research about it because government, this project is launched in 3 countries. You were giving us a lot of information which is not needed in this your. Thank you very much.
Sorry, Mr. Chow. You understand my message? Yes. So, Shadana had something to that.
Yeah.
Yes, thank you very much. Because I also wanted to comment you on that. When you are doing something like that, you don't bring, if you are bringing another country on, they design that program that's peculiar to their society. So the only thing you can do, bring their success rate.
Yeah.
How did they make success?
Yes.
Then can you adopt peculiarity, some particular peculiarity in your own? But other you are just putting this ones, we are saying this before, maybe you go for another competition, you be the one like that. If you put this, they will not look at it. Because you are not so, all these things you mentioned earlier, like it's not your critical thinking, it's not your innovations. You are taking some people who have done something peculiar to their environment. Thank you, Mr.
Thank you very much for the questions and the comments. Thank you very much. I think the first question is about how the private sector can come in to actually increase the awareness of the ruralists. The first one, I think I mentioned corporate social responsibility. It has to be very strategic. You know, when a particular private sector, let's say farmers, for example, recognizes a particular rural environment or village, they tend to go there to do maybe an initiative. You know. Then they meet their village heads, discuss it with them. From there, they will be able to pass the message they actually want to pass to them. Also, the use of social media. Yes, they actually have phones, and most of them are on TikTok and all of these things. So I think the private sector can actually invest also in the use of social media to improve the knowledge and awareness of these ruralists and others. Also, the third one I have here will be the community-based animal health workers. They are living with these people, and that's why they are called community-based. So they can be trained. Private sectors, farmers, helpers can identify a particular village and ensure that there are some persons they can bring out from there, educate them, and after that send them back into that particular village. The message will be very well passed across. Also, for Prof's question, regulatory, it's actually a regulatory bottleneck, and that's where I think the government should help. The private sector cannot do it alone. They have to be backed up. And that's why I actually added some of these examples, because their government actually backed them up and there was massive improvement. Thank you very much.
Thank you, Emmanuel. That is the fourth presenter, Emmanuel Temitayo. Let me share something with you based on the question Professor Jibril raised. I think he said that among the actors, that is, if you will be one of the actors, how will you fit in that is your own vaccines will be accepted by the communities or the herders. I'll still go back in February when we attended the Pop-Home workshop. You know, the Director of Veterinary Services, Adamawa State, we didn't know that he was holding a vaccine. He put it in one of his traveling bags, and he asked the minister. He said that he wants to share something that happened in his state. This group of people, they were producing oxytetracycline long-active because the vaccine was out of circulation. So in Adamawa State, they were deceiving the herders that they have the correct LA. So what they were doing, they got drums and they fermented tamia, this tamarind. And you know, if you look at the color of the tamia, is getting just like LA. And what they added to it, they now ground this small pepper, yachi, and put inside. So that when they inject the cattle, that pen, that LA pen, the animal will now kick as if it is the real LA. So it was when they started losing their animals, they raised an alarm. And the DPC himself, he did a very marvelous job. He contacted the DSS, and they were able to trace and arrest all the people that were producing this. So that is still emphasize the importance of the private sector keying in vaccine production. Thank you very much. In fact, he brought this thing and showed it to all of us, Nigerians. So we'll take the fifth presenter, Emmanuel Tolu Ororumolo Gaga. This your name will make me to score you less. No, because it's just difficult to pronounce. Assistant, you can't take a look at your presentation. I'm just cracking jokes.
Thank you, sir. The Dean, Faculty of Veterinary Medicine, the Assistant Dean, the Chairman and the panel of judges, and fellow student co-presenters, good afternoon. My name is Emmanuel Tolu Olorunmodada, and I'll be making a presentation on the role of private sector in scaling ruminant vaccination coverage in Nigeria. As we all know, the ruminant subsector is a major economic pillar in Nigeria, in that it owns the largest herd. Nigeria hosts the highest herd in African massive livestock assets, contributing about 17% to the national agricultural GDP share, and it supports livelihoods across Nigeria up until 25 million households. Now, we are talking about vaccination, right? And statistics showing from 2006 to 2023 gave a gap, and we had animal disease cases up to 3.2 million, giving close to 5 million animal losses that we had due to animal disease related callings. And over this period of 17 years, the vaccine doses administered were just 2.2 million to cover the almost 5 million disease losses. This is not even up to 50% of the coverage. And the mortality rates over this period are given in the slides, with the cattle having 14%, about 14%, sheep 13%, and goats 14% also. Now, what are the barriers to the last mile delivery? This is just one of the several other barriers that we have to vaccine coverage in Nigeria. And then we have urban bias. Urban bias, we have public clinics concentrated in state capitals, and rural gaps persist. The places where we have major veterinary teaching hospitals, or places where animal health care is being rendered, are so far from the pastoralist environment. So it gives the last mile delivery as a barrier. And also we have the cold chain gaps. Unreliable power supplies, we know the power grid falls and rises intermittently. So unreliable power break vaccines potency during transit. So it's also a barrier. Before it gets to the pastoralist environment, there would be a reduction in potency. And then even when it eventually gets there, it doesn't do the work in which it is supposed to do. And also large packaging. Most vaccine vials comes in large packaging, like in 100, 1,000 doses, those vials, which are wasteful to subsistence smallholders with like 5, 10, 15 animals. And that's even when they get those vials, when they administer, they can't keep up that cold chain in their environment, even if they eventually get the vaccines now. So the large vials now would impede on the efficiency of those vaccines. All right, and also we have a broad spectrum, which is the public-private partnership. This is a strategic framework for scale. All right, and here are just the few things that are needed from both sectors to make this vaccine coverage an enormous thing. Now, for the public sector, we have a regulator. They regulate all policy, and also they facilitate the policy, and also standardization, making sure that whatsoever thing that is being produced is up to standard. The likes of Standard Organization of Nigeria, these are standard organizations that can actually look into the standardization of these vaccines. Now, for the private sector, these are innovators, distributors, and the last mile experts, bringing in innovations, innovative ways to link to the problems we have at first. Talking about the large dose vials, having to produce like doses within 10, 15, and 20 doses, which can cater for even the subsistence farmers. And also the last mile expert, bringing in ways to get to the pastoralists and agro-pastoralists in the subsistence areas. And now, to innovation and manufacturing. This is the first role I would highlight for the private sector. All right, beginning from the first slide, we have really give an overview. So I will be expanding on that for the role of the private sector. Now, the first, innovation and manufacturing. To produce small pack vials, like 10 to 20 dose options for smallholders, that will go a long way. And also thermotolerance. When we have heat stable vaccine engineering, we can almost engineer things to not be entirely thermotolerant, but then to be heat stable a little bit as to survive the tropical environment temperature a little bit. I believe with innovation that can be done. And also multivalent product. Now if we have a single shot containing multiple for multiple pathogens, the likes of the diseases that are prevalent like CCPP, CDPP, LSD, and the rest of them. When we have a multivalent product, having a single shot capturing a good number of these to vaccinate against those diseases, it will go a long way. And also logistics and cold chain. This is also one of the roles the private sectors can play in ensuring that large vaccination coverage. Off-grid solar. Now, 247, like round-the-clock cooling at regional depots. When we have regional depots, we have across the local government areas in Nigeria, we can have depots situated in at least, let's say, each local government. That would work where we can have regional cooling spots for, solar power now that doesn't depend on the grid, so as to have the cooling spot at regional depots, in which when the supply finishes, it can be returned, and then we have continuous refrigeration. Ambulatory kits, they donate mobile portable cooling for field use and also strategic reserve to buffer stocks for outbreak prevention. These strategic reserves now to take what is happening so as not to have outbreaks, and then there are low preparedness now. Preparedness in the sense that the amount of vaccine available. Now, workforce expansion, franchised delivery. Now, working with VPPs and CAHWs, VPPs, veterinary paraprofessionals, and community animal health workers, contracting private personnel for scale, and also professional training, funding technical refresher courses for even the people that are the vaccinators. These individuals, the private personnel that will be vaccinated, they need to be refreshed on what to do and how to keep this thing safe and effective. Public concessions, executing state campaigns via private firms like the GALVmed, the LPRES, and the likes. Also, demand and education, ROI demonstrations. This is also one of the roles of the private sector to proving that vaccination yields measurable economic return, like the expense of having to vaccinate overshadowing the expense of antibiotic treatments now, giving measurable economic returns. Also, gender intentional extension, reaching female managers or small ruminants. I hail from Kogi State, and I can say from statistics from my place that we have even households. It is the women who are really in charge of taking small ruminants as a case study now. So when we include a gender intentional extension, reaching out to the females, we can cover more for the small ruminants. All right, meat mitigation, peer-led advocacy to dispense rumor of infertility. It's also said that people believe that when you give some certain vaccines, the animal are rendered infertile, their milk production decreases. This is to educate them that does not happen, and it is just a myth. Also, digitalization and tracking. The IKORE part, IKORE part actually, the real-time digital reporting of vaccination and health trends, to have this thing digitalized and also have it compiled. Also, GPS mapping, accurate monitoring of herd immunity coverage coordinates, the ones that have been reached, and how they can also get that in an information system like the NADIS, the National Animal Disease Information System. When we have that together, then we can be informed on the places that have been reached or not reached. QR verification. This is for product authenticity checks. Now, something was raised earlier about how that you can change labels and all of that. When we have this in place, we can always do that, and we receive it even via SMSs and emails. So we can have QR verification, digitalization, and tracking. The private sector can work on this part to scale things. All right, commercial sustainability under finance and policy advocacy. Now, under that, we transition from state donations to sustainable market. Sustainable market in the sense that we have microcredit input bundling, where we can have the initiative being credited by, let's say, microfinance institutions or institutes to have the initiative funded, index-based insurance, and also when you want to insure, you use the metrics and like the number of vaccination and what you have done so far to give to insure the animals. Also, strategic advocacy, collaborating VCN and NAFDAC to streamline registration, and also the community animal health workers task sharing policy. All right. The key implementation challenges: counterfeits, volatility, and security. Now, substandard unregistered biologics weaken farmers' trust, volatility, macroeconomic currency shocks, increased cost of imported APIs, and security. When we have vaccination access to pastoral zone, talking about banditry and insurgency. All right, strategic recommendations: formalize PPP guidelines, institutionalize community animal health workers, digital interactions, as we have said earlier, collocate health and nutrition. Path forward: Nigeria's ruminant transformation relies on moving beyond state dependency to a commercial, private sector-led economy. Solving last-mile gaps will unlock prosperity for 25 million households and secure national food security. Thank you for listening.
Can I have the mic?
You were short.
1 minute, 10 seconds.
Like 10 seconds.
1 minute, 10 seconds.
Okay. Thank you very much, Emmanuel Tolu. Yes, Emmanuel Tolu. Thank you. Very good piece of presentation. Now, question time, please. Okay, I will start with myself, then I'll pass it to Professor Jiru, then you. Emmanuel, looking at your presentation, do you think a private sector, a strictly private sector model will really strive well, or a public private sector model in terms of vaccine production will strive well? You understand my question? Do you think a strictly private sector model on vaccine, scaling up vaccine production will strive well in Nigeria, or a public private sector model will strive well? Thank you.
Thank you, Chairman. Thank you for your presentation.
Yeah.
I think I just have this small question for you. You are also always talking about the remote areas, but I'm even looking at in our own communities here in the urban dwelling. Is there any difference between small flocks being raised in the urban areas and those that are in the rural areas in terms of patronizing vaccinations for small ruminants? Apart from the institutional funds and medical funds, is there any difference in the vaccine uptake based on data or your own experience? And then how do you improve this? This is my question always. How do you improve it coming in as a private practitioner? Thank you.
Yes, my just a comment. I've not seen where livestock vaccine or ruminant vaccine factory in 1,000. The highest you have is 100 doses, and most of them come in 5 and 50. So maybe you are relating to poultry.
Yeah.
Then that the might on vaccination induced infertility in pastoral is no more there, because the extension services in Nigeria has already removed that might from the mind. So they are ready, they are willing to take vaccines for their animals, only that they are in a remote environment or vaccines are not available, or veterinary services is inadequate to reach those rural areas. So you need to rework on your slide. Then enlarge some of your bodies. It's like too tiny. You know, when you are presenting, 3/4 of the space of a particular slide should contain the information. Yeah. You understand? Should contain the information that you want to pass. Not that you have small way of the information is small, you have to take places flowing around. Then you know, you kept on, you started with the livestock population, the problem, then later you also talk about challenges. You have to, it's supposed to flow. It's supposed to flow from problem identification to the secretly the outcome of that problem and why the vaccine or vaccination coverage is very, very important. So you are doing a presentation. Then you can even cost it. What is the value of your solution? That's my question to you now. What is the economic value or the cost of your own solution scaling ruminant vaccination? And lastly, nobody mentioned, maybe because I'm an extension specialist now, I'm no more a pure vet. Nobody mentioned the importance of extension services in scaling this. So you can see hire us in any areas in the future so that we can. Thank you.
Can I have the mic?
Before I will allow you to respond, on the meat, 1992, I was doing my NYSC. I served in Auchi specifically. That it was that year they divided Bendel to two states, Edo and Delta. So we were vaccinating small ruminant, most especially, you know, it's West African guac that they give there, Kogi, all this Eastern Edo. So what we do to get that thing off, each Friday we'll go and to every community, they have a field where they do town meeting. That means to know a lot about Edo State. We'll go there, meet the chiefs. They'll call all the people keeping small ruminant. They'll come on Friday. They'll sit down. We show them the videos of the disease of small ruminant with that of PPR. Then we show them if you feed your animal well, this is how they are going to do. If you vaccinate them, you clear them of this disease. So we are convincing them, and they were bringing more animals. When we do that on Friday, on Saturday we'll go back and vaccinate, and they will bring a lot of these small ruminants for us to vaccinate. Then we'll move to another community. For Kogi State, what we did was, when we go on Friday, the Fulani men there, the herders, they'll say, no, you cannot take blood samples from us because we are taking blood samples for Indapes under the European Commission sponsorship. So they'll say, what are the incentives? So what we do on Friday in Kogi State, we'll deworm every herd will go. If we deworm on Friday, they'll say, come back the next day, Saturday. We'll now go and now vaccinate. So that is the thing. If you want the community, you have to give them some incentive. Yeah. So come and respond to your question.
All right, thank you so much for the questions asked. For the first question, will private sector strike or will private sector try or public-private sector model? Before I entered into the role of the private sector, I gave like the breakdown of the public-private partnership, the PPP, and under that, the manufacturer is actually under private, but the policy making, the following up, and the standardization is under the public. So in a way, there has to be a collaboration between both of them. So the public-private sector would be the best model, sir. Yeah. Yes, sir. So the second question, is there any difference between small flock being raised in the rural areas and in the urban centers? I think that's correct, if I get the question. How do you improve that? So I believe that there is no difference between the number of animals now, like in the herd. from the urban and the rural area. I think the only thing that makes the difference is in the knowledge and the information. So when we have people with even 5 animals in the urban centers, the way they would go towards vaccination is different from someone in the pastoral, the agro-pastoralist in the rural center, whereby even when they get a large dose vial, they can actually store it. Since they are mostly elites now, they can actually store, and it is still functional and it's still working fine compared to somebody in the rural area. I think the only thing is the information gap and the elite level. The third question that I have here is, what is the cost of your ruminant scaling? What is the cost?
The cost of your own solution is scaling ruminant population.
The cost of your own solution, listen to you.
Looking at your ideas now that you have presented,
Yes, sir.
what is the cost?
Okay, there are a lot of things that the private sector can do, and also at the point of economic incentives. Now, I mentioned the part of financing and even index-based insurance. So even when it requires a lot for me as a case study, like let's say I'm going to be working as a private sector now. If it's not going to be easy for me to do, or when I'm so active, I have my data and all, I can be invested in. I can reach out to let's say microfinances and also be given some level of support now to cost all the things that I've mentioned. I hope that answers your question.
It's okay.
Thank you, sir.
Chairman, sir, let me highlight on my question.
Yes. Can you pass?
You know why I am asking you people these questions? You are supposed to be private practitioners, isn't it? And even now, if you want to survey the veterinarians that are actively practicing presently, and ask them just a simple questionnaire question. Are they vaccinating against as simple as maybe PPR? Or how do they rate the patronage of their clients? You will find a very large gap, very large. These are the areas that we want you people to come in and fill, because it starts from you. It starts from you. You have to let them know, instill it as part of routine management of their small flocks or whatever, so that it's not like government that is going to come in with a vaccination campaign annually or whatever time they feel like coming. You, as a private practitioner, you are the one to really make sure that you make it your duty to include it as part of your service delivery to your clients. Most of you are just talking about ideas, about scientific this, scientific that. The basic issue is this: the people around are not even interested because they are not even aware, unless they have an issue before they come to you. So, as a private person that you are just coming into the field, let me give you an example. When I graduated, I came around here, I was practicing poultry practice, and then when I started my MSc and I got the job, a lot of my clients around, it was a tug of war. I told them that I'm busy now, I cannot render services to them. Most of them refused, vehemently fought me, because I was able to relate with them very well and put them through. And many of them up to now, they are telling stories about how they have gained a lot from interaction with me. So that is why we are. We want to hear your ideas. This is ruminant, not poultry. We have problem. People are not even patronizing. If you have even the vaccine for free now, I don't know whether you see people coming to get their animals vaccinated freely.
Yes, of course.
Chocolates are going as with your money you want them to pay. So there's a lot of gap that you people are not even looking at. So this is why I'm stressing this point so that you understand, and you will make a lot of money when you get the confidence of your clients. You are with them 1-2 years and they can see the change in the flock. You understand what I'm saying? So this is why, and you are a professional, so this is why I am keeping hammering on this issue. There has to be demand for something before you can even supply it. If there's no demand, even if you supply it, it will go wasted. Thank you.
Thank you very much. So I think you have finished your questions. Thank you very much, Emmanuel Tolu. The next presenter is Abubakar Adamu, the class rep himself.
Thank you very much, distinguished judges, co-presenters, students. Let's just imagine a livestock farmer in a rural society in northern Nigeria walked into his livestock cattle pen on a very good morning, 6 a.m., and realized that some of the cattle are finding it difficult to breathe. In days after, many of them became very sick. Months after, they lost most of the cattle. These are his source of livelihood to take care of the family, the generation wealth that have been passed to some of them and they needed to pass to their generations that will come after. And this is what they need to survive as pastoralists. What do you think would happen to this livestock farmer? The painful part is that the disease that killed those cattle are preventable diseases. Vaccinations are available. Veterinarians have the knowledge. With their accesses that have been available for those diseases to be prevented. But the problem is not the vaccine failure. The problem is vaccination ecosystem failure. Distinguished judges, I am Abubakar Adamu by name, and today I present to you GALVmed, which is a Nigerian integrated ruminant vaccination ecosystem. It is a private sector-led digital ecosystem for scaling sustainable ruminant vaccination in Nigeria. Now, the vaccine existed, the veterinarians had the knowledge, yet the animals still die. Why? These are some of the reasons. Poor last mile vaccination delivery. Vaccines don't get to those rural community. Those pastoralists move from one place to another. And when there are issues, they are not even aware of some of these challenges and how to go about getting vaccines for their animals. There is also weak cold chain systems. Most people try to intervene, get those vaccines to those people in those rural communities. But at the end, when the vaccines get there, it fails. When they vaccinate those animals, there are instances where it will not be effective. There are instances where the vaccine that is supposed to protect the animals becomes virulent to them due to vaccine break. Now, there is also delayed disease reporting. Most of these pastoralists don't even know what to do when they are encountering challenges. Some of them know they needed to reach out to people. They'll try personally by themselves to resuscitate that condition, but at the end, they don't know who to run to or how they can easily access a veterinarian or any vaccination center that could help them. There is also limited access to veterinary service. In most parts of the rural communities, most veterinary establishments are within the town. They are not closer to these people that need them the most. So the key message here is that Nigeria do not have a vaccine problem. Nigeria have an vaccination ecosystem problem. And why does this matter? These livestock are not just the cattle, the sheep, and goats that we all think. These cattle are food security. They are basically rural livelihood. These people need these cattle to continue living. They are basically source of nutrition. Protein, Nigeria have not still been able to meet up to the required protein source. And this also is important in the economic growth and the national development. Yet, vaccinable preventable diseases still kills animals daily, despite existing vaccines. Now, the good thing right now is that Nigeria is not going to start from a zero level. There are good works that are already going on by the Ministry of Livestock, strengthening veterinary service. We also have the National Veterinary Research Institute producing priority vaccines. Then we have GALVmed interventions, veterinary pharmaceutical companies still producing vaccines and bringing them into the country. We also have private veterinary practice like AmbuVet. There is a program they launched training para-professionals going to these pastoralists in their rural environment to see how they could help vaccinate some of those animals. Cross too is doing excellently well. Universities are still making research. They are training professionals like us to become veterinarians that can be able to cope some of this challenge. But this effort often operates parallel, rather than as one coordinated system. Everybody is working. They are trying. Some sectors are collaborating, while some sectors are just working independently. So the missing aspect of this whole thing is just an ecosystem, and that is why I brought to you NARVE, which is a private sector-led framework for sustaining, scaling ruminant vaccination in Nigeria. This NARVE, it's going to be a system that would have a digital app that will also connect every stakeholders. The government should come in, provide leadership, regulation, and also policies that will help in achieving ruminant vaccinations. Veterinarians will also come in. Farmers will be brought closer. We will not leave them and do what they do. There will be interventions that will bring the farmers closer. Let them not think we are just here to make them pay for all that we are rendering to them. Then vaccination manufacturers, companies like MVRI can be empowered to see how they can produce more vaccines. Technology too will develop an app that will help and see how we can help in preventing, reporting diseases on time, and also make sure that these pastoralists reach out to us. Then we'll also bring in bank into this whole vaccination process, seeing how banks can give resources to those farmers, let them be able to vaccinate these animals, extend the loan, and make it affordable for them to pay without even eating deep into their pockets. Then insurance company, we should integrate insurance company to see that when there are losses, large amount of losses, they can also be compensated, provided that their livestock are properly vaccinated and it is not a vaccinable, preventable disease that occurred. And logistics also, in the aspect of the cold chain transportation, when we partner with them, we can be able to bring some of those things into reality. Then universities too, we need to do more research, provide more data, because one of the major challenges in Nigeria is data to act on. There might be source of interventions, but they don't know which area have been vaccinated, where is still remaining, what has been done in this aspect. If what happens most time is when there is an outbreak, the federal government just send people to vaccinate. Some of these animals are already having this disease. Vaccinating them again at that point will not help, and the rest. So this NARVE, our vision is a coordinated technology that will enable a private sector drive vaccination ecosystem. And the mission is to deliver the right vaccine at the right time to the right farmer and through the right veterinary professional using trusted digital system. Now, NARVE is going to work on 6 strategic pillars. Smart vaccination access. We understand the distance. Vaccines are available, but availability of vaccines cannot influence vaccination. It needs to get to them. So bringing those logistics companies, power solar logistic companies on mobile motorcycles can easily get those vaccines to those pastoralists wherever they are. Then there is also digital livestock health passports that will be invented, that every animal or every livestock farm that is vaccinated, the type of vaccine that is given, they will be entered into that app and see that anytime there is disease condition, the veterinarian that attend to them, their details will also be inside that. After that, as they go forward, this tag will be invented together like the way the ear tag is currently. There will be a QR code that would be there that as a veterinarian, most of these pastoralists might not have a smartphone, but there is a way we have integrated to cover that aspect. But every veterinarian, every paraprofessionals, we are digitally inclined now. We can easily take some of those data, see what has been done by the previous veterinarians, and see how to intervene. Then private veterinary enterprise programs, we need to train more paraprofessionals. We need to bring in animal scientists and see how we can be able to scale this. Then there's livestock vaccination financing and insurance, bringing back industries. Then national disease intelligence platform for surveillance, disease outbreak, and quick interventions. Then farmer behavior, which is the major challenges. Some of those farmers don't even know, they don't even want, there is different misconception. Animals are okay, probably they're incubating a disease and they needed to intervene, but they don't want to call people because they feel maybe one veterinarian have vaccinated before and that's when the animals got to come down. So we need to change their behavior. So this is how the technology will work in different aspects: the QR code, the livestock disease, the temperature monitoring, automated alerts. When vaccines are below the normal temperature in their cold chain, it will give an alert. Then the livestock wallet. This is a prototype video to show how we can enter the database of those animals by paraprofessionals and also the professionals. Then in this database, this prototype, every information that is done, we can easily send an alert to the full animal, so they can easily, through their smartphone, like an SMS, they can dial DSS code to get that done. So these are these key actors that are needed, and when this occur, there will be innovations, investment, there will be last mile delivery, digital solution financing, and farmer support. Now this is the implementation roadmap. We then starting this from 6 states, covering 6 geopolitical zones, then scaling up, and these are the expected impacts if this is integrated. And NERV ecosystem will help in not just solving the ruminant vaccination system, but also help in research and disease surveillance. So I want to leave you with this last thought. Vaccine alone do not save animals. Effective vaccination does. Thank you very much.
Okay. Thank you very much, Abubakar Adamu. Another good piece of presentation. Let's take questions on this, please, audience. Yes, Dr. Main and my head of department, public health. You know, I share department. So I have 3 departments with you.
That's helpful. I have a question.
Thank you, Mr. Chairman. Hello? Thank you, Mr. Chairman. Now, I don't know whether this is a question or a contribution or a comment, but I remember in my days in the clinics, Professor Ngoya taught us about vaccination against rabies in the dog population, and he told us to target 80% of the dog in any population. If you can target 80% of the dogs, even if there's a rabies case, it can only, because you have herd immunity, that it will be isolated. So I like this presentation and many of your presentations. I think these students have done very well. They have worked very hard, honestly, against the backdrop of where they are coming from. I think they have worked very hard. I don't know whether I would have done the same way if I were their shoes, honestly. So the class rep has said something very important. It is not a vaccination problem as much. It's not a vaccine problem as much as an ecosystem problem. Your target as a doctor or as a private entrepreneur, whatever you call it, is how can we effectively deploy our vaccine to protect 80%? I don't know whether it's the same for the ruminants.
Yeah.
So how do we target 80% so that whatever, see, the issue of fake, we are Nigerians, the issue of adulteration, the issue of we are corrupt, we are a corrupt system, it will happen. But you, as person selling telling them about how we can scale this vaccine and vaccination. How can we target 80% of the animal population so that we can create herd immunity? So that whatever it is, whether there's vaccine break, whether they missed one animal or the other, there's no serious outbreak to the point of becoming maybe a pandemic. So that's why I said I'm not sure whether I'm contributing, making comment, or I'm asking a question. We can decide to.
Thank you very much once again. Just a little information. You know, this, the whole of the program sponsored by a program plus a project. So, on issue of vaccine productions, that aspect has been solved. We are giving money to MBRI improve on vaccine production. But they realize that it's not the production is the problem, it's the delivery system. And this is where these things are coming out. It's the delivery system to get to the public. So the question I'm going to, because your integrated system has the producers, I'm just telling you that aspect. The NAF, is it your own idea or is an existing program with the livestock? Issue of livestock. If it's your existing program that you wanted to adopt or modify, so I think you should have, because you show something like missing link, from here we cannot see it. It's not very clear. So we couldn't follow that missing link. Then secondly, the way I'm seeing it is like it's a computer-based system, digital system, isn't it? It's not a digital system. Because the way I'm seeing it is everything, as somebody is queuing, the records is being digitalized. So don't you think there's going to be a problem with the people within the rural areas when we know that even the infrastructure is not there?
I think my comment and questions has been said by Professor. But in case he answered one of the questions yes, then I can now make my comment.
I just want to remind us about two things while we continue. One, that we are being streamed by, of course. And then secondly, the light has been, the electricity has been very
friendly.
Has been very forthcoming and friendly. So maybe we can have structured questions so that they answer, so that we can write up this thing as quickly as possible, because once they take off the light, we'll have to now look for alternative sources. But we're making progress. Thank you very much.
So the answer. Okay. We have two more. No, two presenters. So let him respond to the question, then we'll take the last. Sir, so we do not take the two presenters before question time for them, isn't it?
Those that, like I said, we may have to scale down on the comments.
Okay.
Comments take some time.
Okay.
Once you go to the question and an answer, it reduces our time.
Okay, sir.
It improves our time.
Okay, sir. So go ahead.
Thank you very much for the questions. The first question is, how do we target 80% of animal populations? Now, to answer that, that's why we need an integrated system. And this will also help me answer the other question, which is, if it is only a digital-based system alone. It is not only a digital-based system. The integration has to do with the government, the private veterinary practice, who have also would extend their services by training other para-professionals, health workers, and also people that are within this rural community to have access to the basic knowledge of vaccinations, what it entails, and how they can be able to ask, request when the needs arise from veterinarians that could easily provide those access to them. Then there's also logistic aspects to where we need to partner with logistic companies. Some of these companies are not things we are going to develop, they are existing. The technologies, most of those technologies are highlighted. They are being used in health sectors, agriculture, and some other companies, and it's working effectively. So ours is to integrate them into livestock health and make it better through getting access to all these vaccines in anywhere. With mobile motorcycle, they can easily get vaccines to every part of the country and scaling it up to cover 80%. When we start from the pilot phase, we'll start at the 6 states, cutting across 6 geopolitical zones. Involve the government, the private individuals, the logistic companies, and the bank within that state, and test run it within 1 to 3 years. When we see the effects effectively, then we can now extend across every other state, and that way we can have 80% of Nigerian animals vaccinated going forward. Then this NAB, is it my own idea or it is an existing program? It is my own idea, solution to the problem of scaling ruminant vaccination, and it is an integrated system. This is what I feel, if this is put in place, working hand in hand with the government, private sectors, and other companies, technology, bringing all these things in place, we can be able to scale ruminant vaccination in Nigeria. And how would this, is it a digital base? It is not that alone. It has a digital technology sector, an app that can, all veterinarians, private paraprofessionals can use it. This is to help us in disease surveillance, reporting disease in any aspect where there are cases. That way we will have data to act on. We will know how many animals have been vaccinated in every state. We will get to have every data, and if there is any outbreak, we will easily know where to intervene. Thank you very much.
Thank you, Abubakar Adamu, for responding appropriately on the questions being raised. We are going to take a little moderation on the tune of presentation. The remaining 2 presenters will present at once, so let's take note of the questions that we might want to ask them. So I will call Kahir Abdullahi. Abdullahi, if you come, you make your presentation, we'll take note of the question, then again Amina Jafar will come and make a presentation. Thank you very much.
Oh, sorry. It's your first one here. Okay, sir.
Take the next one.
Okay, the next person, please. She has not yet, she doesn't have her one there. Okay, please, can you, the next person. Yeah, only presentation. Thank you. Amina, can you make some presentation? Make your presentation.
Don't scare her.
Check the document first and declare the document in that.
Delivering the PPR ruminant vaccine is the easy part of pesti-the-petit ruminant disease control. I dare to say that. And this is because after the vaccination campaign has ended, one question remains. What animal was vaccinated? This is the gap that I hope to solve with my idea. The Dean, Assistant Dean, panel of judges, the chairman, co-presenters, and fellow students, good morning. My name is Ahmadu. If you notice, the subtitle of my heading is Delivering the Dose is the Easy Half of This Job. This is a scalable model or a private sector enabled digital traceability model for scaling sustainable small ruminant vaccination coverage in Kaduna State. We're using Kaduna State as a case study. Now, let's say in summer this morning, we went out for vaccination and a herd of goats were vaccinated. And 3 weeks later, a case of PPR was reported in Haindogo. When the veterinary area officers arrive at the location, they are plagued with a couple of questions. Have these particular goats been vaccinated before? Who exactly is the owner? Are they isolated? Are they extensively kept? Are they intensively kept? How do I really ensure that this animal has been vaccinated and it has not been vaccinated? This blind spot is what this model exists to solve. And closing this is fundamentally the private sector's work. Now, the Nigerian vaccination system isn't failing. In fact, it is doing exceptionally well. I would like to state a couple of achievements that our system has currently made and why this model fits perfectly into the system. We want to change the mentality that Nigerians have. The minute something is broken, Nigerians prefer to throw it away rather than fix it. And this model is going to fix the problem rather than replace the government system. The Nigerian government has led national PPR vaccination programs coordinated by the Federal Ministry of Livestock Development. It has also locally produced live attenuated vaccines against the PPR disease by the Veterinary Research Institute, NPRI, in Bom. And currently in Kaduna, we have veterinary teams reaching thousands of sheep and goats. So clearly, vaccines are available. Maybe you can argue that they're not enough, but they are available. And the government is issuing to produce even more. But where does this break down? Once the vaccination campaign has ended, I will take you, when I move forward, I'll take you to how these vaccinations are done. But once the vaccination campaign has ended, there is no specific identification at the animal level. Rather, we have a campaign level identification. We also have vaccination records, like I said, that are campaigns-based and not animal, individual animal specified. And the veterinary teams, when the disease outbreak occurs, cannot specify which animals were vaccinated and how far has this animal traveled. Because we all know that in this case study in Kaduna State, where we are most familiar with, most of these sheep and goats are extensively kept and practice free grazing. So I believe that a vaccination record that stops at the syringe is a record that has failed to protect the animal that it is meant to protect. Now, the theme of this award is what is the role of the private sector in scaling ruminant vaccination coverage? Keyword being coverage. Keyword being coverage. I want us to remember that keyword here is coverage. The private sector can come in a couple of ways. Once the government leads vaccination, private enterprises build the layers that makes that vaccination count. So we have data verification, logistics and cold chain, and last mile service delivery. These are the pillars that in fact guide this particular award, because we have access, awareness, and also advocacy in the Vital 2 project. Now, private technology companies design, host, and maintain the traceability platform. This is what the tag trace model is proposing. We also have the private transport and cold chain providers who move vaccines from VOM to field and keep it visible. And then we have the last mile delivery service. And there's something particularly interesting about the last mile delivery service. We know that we have community area health workers, but we also know that the women in these communities are the ones who are in charge of these particular small ruminants. Women and youth make the majority of people keeping and tending to these ruminants. So I'm proposing that we have community women livestock mobilizers. Why did I choose PPR and why now? Remember I mentioned that the key word here is coverage. Keyword being coverage. To support the 2026 to 2030 PPR eradication plan, the Federal Ministry of Livestock Development is expanding MVRI facilities to produce 100 million doses annually. These are facts, these are figures, these are standards. This is going to happen if it's not already happening. Now in Nigeria, we have about 138 million goats and 64 million sheep. That is a very massive number. But in Kaduna alone, we have about 1.282 million sheep and goats. So what is at stake for the stakeholders? PPR is one of the most economically devastating diseases of sheep and goats in Africa. We're all aware of that. And for many rural households, these flock of sheep and goats are their working savings accounts. These are their bank accounts. If there was an emergency, they would sell them. If they needed money for school fees, they would sell them. If there was hunger and starvation, they would sell them. So that narrows down the lifespan of these particular ruminants, but I would also take you there when I get there. Now, like I said earlier, women and youth are disproportionately dependent on sheep and goats when they consider it for their housing and economic value. Now, I cannot continue to talk about the vaccination and PPR without telling you what the vaccine is and how it is transported and everything that has to do with it. That is the way we're going to understand where exactly the problem is and where we need to come in as the private sector. Now, the Nigerian 71 strain is a live attenuated vaccine that is manufactured at NVRI. I told you earlier that production is not our problem because the Federal Ministry has given the mandate. NVRI is supposed to begin production if it has not already started. Now, this administration is done subcutaneously and it provides a long-lasting protection for the animals. And it's usually, I have another slide for that, but it is important that we focus on these factors because, again, my solution is going to come in at every point. We also have the fact that the vaccine is thermolabile and the potency is degraded under heat. Now, like I said earlier, I mentioned that we have the systems that these animals are usually kept, and this is where the gap lives. We have the intensive, semi-intensive, and the extensive system, and particularly in this case study, Kaduna State's majority of these animals are kept extensively. So this means that they are free-ranging and largely pastoral, and animals intermingle with neighboring flocks and rarely carry a permanent identification. Who can and can't be vaccinated? Like I said earlier, because of the fact that these women and young people and families depend on this thing for income and savings and economically they are of high value to them, they shorten the lifespan greatly. So an animal that's world standard is supposed to live for 8 to 10 years has been reduced to live for 3 to 5 years. And this is what makes the vaccine very potent because this vaccine has a very long, it acts and protects the animal for a very long time and you can cover the entire 3 to 5 years lifespan of the goat. And you cannot vaccinate before 4 months and you cannot vaccinate during late pregnancies as well as animals that are pyretic, have a fever or are under stress. Now, what is the last mile? We've been talking about the last mile, we're talking about access, we're talking about advocacy. The last mile has to do with how the vaccine gets from the manufacturer to the beneficiaries. That's the farmer or the pastoralist that owns this herd. So the MVRI to MVRI production, and then Federal Ministry of Livestock, and then the Kaduna State Veterinary Services, then area veterinary officer, then the field veterinary officers, and then the animals. This is what we're currently working with, right? But I told you that I want to include livestock, community women livestock mobilizers here. And why is that? I will take you there. This is tag, trace, trust. And it is self-explanatory. We tag the animals, we trace the animals, and we ensure that the community has confidence in us by trusting us through these community women livestock mobilizers. So for tagging, we use a barcode ear tag. We use a barcode ear tag that each animal that is vaccinated has its biodata taken. And then we trace these animals so that we know exactly how far they have moved. Right now, we're using a zonary system where we check, oh, these animals are in this zone and these animals are in this zone, but they're extensive grazers, so they cannot particularly contain it. Rather than check the animal zonally, we need to check it on an individual animal level. And then how do we build trust? Systems don't build trust, people do. And this is why we need the community women, as well as the community area health workers. So like I said, tag. It is fitted right after the injection. It is an air tag, a barcode air tag unique to each animal, so proof of its status travels with it long after the field team has left. Remember we said that these vaccinations are currently done based on campaign or outbreaks. But even after the veterinary team has left, they still have this animal's data, and individually, not based on the campaign. So they know the exact vaccination date, the owner's name and phone number, and the species, breed, sex, and estimated age recorded at the registration. We have traits. This is for animals that don't see food. Again, you'll notice that this slide looks exactly like the one for the extensive grazers. So for these animals that don't see food, you have a barcode on these tags that you can scan and log. Every scan of the barcode will timestamp a location and build a movement trail. So you know the point where you vaccinated these animals, and then when you scan the barcode, when you are with these animals, you would compare, okay, these animals have moved from point A to point B. So I can assume that the rest of the flock have also moved to this location, and then trust the human infrastructure. So the barcode only works if someone, a farmer already trusts, convinced them to bring the animal back. That's where the community women livestock blazers are at the forefront. And why women? In Nigeria's own Kachia Grazing Reserve, Kaduna State women's self-help groups have been shown to actively drive uptake of animals and human health programs within pastoralist communities. Trust built through women networks, not around them. And then the World Health Organization, Nigeria's own disease surveillance data shows that for the same pattern for women trained at community level. So this is the difference between the campaign-based coverage and the animal. I've already explained them. And this is what the TTT model is all about. And this is the synergy between the private sector and the government sector. So we're incorporating the private sector into the government sector, not replacing any system. And then we have the 9 enterprise categories and TTT model activities. Due to time, I cannot really state all, but we have the animal ID air tag manufacturers and the rest of them. So for tag animals first, this is the short-term, medium-term, and the long-term goals. And before I go, I want to leave you with this. The dose protects one animal, the record protects the herd, and the mobilizer protects the program. Thank you.
Thank you very much. Ahmadu, very nice piece of presentation. I don't know whether the next presenter is ready. Ready or not?
You're right, Rob. We can ask questions.
Yes. Okay. I think we'll start. No problem. I'm wasting time because I want to start the question myself. Amina Javaru. Once I want to appreciate you on your presentation. You adopted TT model, isn't it, based on your presentation? And you only dwell on PPR. Yes or no? No, I want us to work together.
It's a case study.
Yes, you adopted a TTT model, then you only dwell on PPR. Good. Is it correct? Yes, you are my friend. Now my next question is this. You see, there was a topic, Amina, that was given to you. I liked your presentation. Let me be frank with you. How I wish this TT model covers most of the livestock disease. Yes. It's just a commentary. I'm not asking you a question. Yes. So I think I will want Professor Jibril to also ask you the question you intend to ask. But me, I want you to know that this is how I understood your
Chairman, I didn't even raise my hand. I was busy, but I'm just saying that we can ask questions. But it's interesting. However, your slides are not reader friendly. So please, when you want to make presentation, ensure that the font size of your slides large enough for us to follow. That's why I would even follow you, because I'm dividing my attention between my writing and you. But this issue of tagging usually works in an ideal environment where people live by the rule. That is why you may tag a bed here and relieve it. And somewhere, maybe in Lagos, somebody will see the bed, and even if that tag is missing, it will be posted back to you, isn't it? To know that this is the end of your road for that bed. In our community, at times it will find it even difficult for people to agree for you to tag their animals. That is one. And then even if they are tagged, those animals will easily change hands. The other person that is going to get the new animal now may not have any consent, have no any regard for your tag. You may decide to remove it and throw it away. Because this is something that is done with consent initially, isn't it? And the consent must be maintained throughout. And you can't keep the animals in one place. So most of these things, when you're designing a program, you design to fit. You may need some adjustment. That is just my key highlight to you. It's a comment. You don't need to respond to that. But it's a beautiful idea where things are working. Yeah. But we want something before then. Yes. Your one is a very fantastic target that we will want to achieve in the next few years to come, while we have more information. This is my own just contribution.
Yeah. Thank you, sir. Please, I want to ask you, you were talking about animals being vaccinated once for PPR. Nigeria is an endemic country for PPR. Do you think vaccinating an animal once will suffice to protect the animal throughout its life? Then, secondly, you are saying the PPR vaccine is thermolabile, if I heard you very well. It comes in freeze-dried form, isn't it? So what can you say about the freeze-dried vaccine and the liquid vaccine in terms of this thermostability? Thank you, sir.
I think we've exhausted the question, isn't it? I come and respond.
Can we make comments on our presentation?
Let them.
Thank you very much for your questions. I'm going to start with the first question that says that I only dwell on PPR. So after researching on this particular program, we found out that student creativity is greatly emphasized. So I figured to stand out, I needed to use a case study with where I'm most familiar with. And that is why I chose PPR. And this case study is scalable. And this is something that can be used not just in PPR, but all the other diseases that were mentioned as high priority diseases by GALVmed. Thank you very much. The second question was about the tagging, the entire tagging thing that has to do with, okay. So the tagging innovation is supposed to be government approved and government supported. And the community women livestock workers are very instrumental to this project. I know that one of the major problems we face is that the community members may not even want to agree. They may not even want to support us because they would say that some innovations have come before and they started and they left. That is where we're using the community women livestock mobilizers. These women are the ones that are going to build the trust and confidence in this particular innovation. It is the work of these women to report back to the community area health workers that report back to the veterinarians to strengthen the innovation. And then also, it becomes a surveillance tool. So part of the research that was done for this particular innovation was that these tags are government insured. So these people have already been told, if you see a particular tag that has ZR1234, you know that this goat is coming from Zaria. And if the government officials were to catch you with that goat when you are in Kano, there will be a lot of questions raised. Also, there's a question about this vaccine being freeze-dried and not the liquid form. So yes, this 75-1 strain comes as freeze-dried pellets. So the problem that we have also established is not just in the vaccine itself, but it is after reconstitution. We know that it's supposed to just spend a span of 2 hours. So this entire framework is built around after you have reconstituted, you need to make sure you keep it effective. Okay, also there was a question that asked if one vaccination would suffice. That is why I emphasize greatly on, in this particular case study, these animals are kept for a maximum of 5 years. So in this particular case study, which definitely can be improved, these animals are kept for the period that that vaccine would continue to be effective in their system. Thank you.
Can I have information? I think the future vaccination is supposed to be repeated annually. Yes. It's not but there's a range. We can cover for up to 3 years maximum, not up to 5 years. And the efficacy of the vaccine differs from the strain too, and the animal species. And a lot of researches are going on, even on the age, the best age to vaccinate, though it's not just acceptable globally, but they are working on all those things. So don't expect that once you vaccinate, it will cover for 5 years. No. Normally, routine annually vaccinated. That is the standard, especially in endemic areas.
Sir, Chairman.
I think it's clear, isn't it?
Yeah.
Okay, so you make your presentation now. Assistant Dean, can you time out? Okay.
Health protocols duly observed. My name is Khair Abdullahi, and I'm here to make a presentation on the role of private sector in scaling ruminant vaccination. Nigeria is home to Africa's largest livestock population. Largest livestock, with an estimated population of 58.5 million cattle, 124 million goats, 64 million sheep, 14 million pigs, and 180 million poultry, according to the Federal Ministry of Livestock Development. So 21% of the agricultural GDP is contributed by livestock farming, thereby having significant impact on food and nutrition security and job creation. These animals are perpetually threatened by diseases, among other factors, causing up to 450 million USD losses annually. To make a little emphasis on the importance of ruminants, the number in cited data represent head count and not necessarily nutritional value or portion size, which means a single cow is over 200 poultry is equivalent to just one cow. So according to the According to the World Animal Health Information System, fish and boundary animal diseases of ruminant are among the top 10 most reported diseases, with the northwest, north central, and northeast part of the country bearing the highest burden. Following a multi-stakeholders meeting on animal health in February 2026, these were the problems identified. Mega domestic vaccine production less than a quarter of the requirement, lack of cold chain accountability, untimely vaccination, often during outbreaks rather than as preventative. Unvalidated, sometimes counterfeit vaccines, leading to loss of farmers' trust. Impairment of cold chain will lead to inadequate vaccine coverage, subsequently disease outbreak, loss of end users' trust, low vaccine demand, low vaccine supply, and going back to inadequate vaccine coverage. So this is the pathway of adopting a vaccine through availability, considering availability, access, and also demand. So these are the recommendations. Stronger public-private coordination, accountability, traceability, quality assurance along supply chain. Improved regulatory timeline for animal vaccination. Adopt the East African model, that is digital multi-stakeholder regulatory and recognition system. Improve remote area reach through community animal health workers. There are already existing animal health policies in Nigeria, which includes the National Animal Disease Information Surveillance, National Roadmap for Veterinary Services, the AMR NAP 2.0 strategies, amongst others. So, insufficient public funds and politics of discontinuity are some of the bottlenecks encountered. According to the World Organization of Animal Health, public-private partnership is a joint approach which the public and private sectors agree responsibilities and shared resources and risks to achieve common objectives that delivers benefit in sustainable manner. These are some of the examples of private sectors we have in Nigeria. Amongst the roles of the public sectors in the PPP are regulation and oversight, public policy development, funding and resources, and others. Meanwhile, the private sector has the role of investment in innovation and technology in the PPP, and so on. We need to move from a vaccine market to a vaccine system where government regulates, private sector supplies, vet administer, researchers validate, and farmers trust. These are the words of Dr. Samuel Azaku, the Chief Veterinary Officer of Nigeria. These are the actions of some private bodies in scaling vaccination. GALVmed and Vital 2 project, commercializing of safe vaccine and last mile delivery. The APOVET MTI Animal Partnership is to scale up nationwide distribution. So we take to this year as an example of a successful PPP where the government paid private veterinarians to scale vaccination in ruminant. achieving from 48% in 2026 to in 2006 to 75% in 2018. These are some of the hindrances of Tunisia's model, which made it unapplicable in Nigeria. Another example is the case of Ethiopia under the EU-funded Ethiopia Vet Association grant. Vaccination against PPR and goatpox achieved a remarkable 92% herd immunity compared to the anticipated 80%. The partnership was transactional, that is, vet and vaccine suppliers gain. It was collaborative and transformational. I put forward proposed modification to Ethiopian model for application in Nigeria, adoption of an approved vaccination calendar to facilitate preventative vaccination rather than the common vaccination we do during outbreaks. Employment of veterinarians and paraprofessionals in mass vaccination, harmonization of all existing partnerships to scale vaccination, involvement of academic institutions in monitoring and evaluation through pre- and post-vaccination surveillance, prioritization of most affected regions, that is the Northwest, North Central, and Northeast, digital stakeholder registration, recognition, and traceability. As this is a move towards prosperity, it answers the call of some of the sustainable development goals.
Just finish.
Use the laptop.
Use your laptop. And then said it. Thank God. No, just continue.
Which includes the SDG 17 partnership for the goal, SDG 1 and 2, no hunger, zero poverty, SDG 3, good health, SDG 8, decent work and economic growth, and finally SDG 9, industry, innovation, and infrastructure. These are my references, and thank you for listening.
Thank you very much, Kerry. You presented under 10 minutes, 9 minutes, 44 seconds. So, questions from the audience for her. 3 questions, please.
Just question.
Question. No question for her? If there is no question, then I'll make a comment.
Thank you. I don't know quickly, you mentioned Tanzania problem and you mentioned why it cannot be implemented in Nigeria. Is it Tanzania? You mentioned Tunisia. Tunisia. Okay. But you just tell us that it cannot, what are those things? And why it cannot be implemented in Nigeria?
Hello. Prof, actually, this aspect of your question, Professor Kabir, are you listening? This aspect of your question you asked her, honestly, you know, if you watch her, she has some contents in the paper that are not displayed on the PowerPoint slides. And I think that's what prompted that your question. I also have that observation. She just made it, but she was reading that from a paper that she was holding. Yes. So if you have, maybe you can respond to it. He is saying,
So
what are those things
yes,
from Tunisia?
Yes, what are the things and why are they not applicable in Nigeria? So the government paid private veterinarians to scale vaccination in ruminants. They paid private practitioners. So whilst in Nigeria we have limited funding, we have low funding for that. That is why it is not applicable in Nigeria.
Okay, so government paid private practitioners in Tunisia?
Yes.
Okay, that's a comfort zone there.
What there is accountability there, like in Nigeria context. Yes, if you give me, even myself now, you give me money to go and do rural vaccination of 1 million animals, I may decide to vaccinate 200,000 and settle the police of there for the million. I'll go to some area to go and pay. So Nigeria is a factor. We are not corrupt. I don't want to use that as an accusation. We are corrupt.
Okay. Thank you very much. Okay, somebody said you make commentary. Okay, Dr. Tijani, you said you want to make some comment, isn't it?
Yeah, on number 7. Although it's been covered.
Oh, yes, no need now.
The slide is very poorly prepared.
Yes.
Yeah, it's very poorly.
That is
if I'm to grade on confidence,
she has confidence.
And
Of course.
this approach can project to
Yes.
international
Yes.
organization
Yes.
for any project.
You can present.
Yeah.
No, she can present.
I need to found.
Yes, very
excellent.
So, assessors.
Yes.
You are already assessing.
No, we have assessed them. We have assessed them. In fact, as the candidate goes to sit down, I've already added up. So, is there anything, or I should go ahead and wrap? I think.
You know, we have the video pitch for.
Yes. I don't know how you structure it, Dinsa. If after this session, we as assessors will go in and
we'll take the video pitch here.
Yes.
Then when we finish, we don't have to go in. They will just leave us, or they stay here. We go in.
Yes, that is my thinking.
Okay,
they stay here.
We
go in because, of course, they are expecting feedback from us.
So let's take the video pitch quickly.
Okay.
5 minutes, I think.
Are you set?
Yes.
Don't drag us again.
Look, first check Muhammad Bashir, how do you make video show Papa? Make it control. Excuse me. Excuse me.
This one is enough for us to pronounce like it for them.
Chairman, I think the video pitch is our focus with the video pitch will be the strategic thinking. The strategic thinking. Yes. It's simply giving the individual a short period to be able to give us solution.
Yes.
So the strategic thinking here is what we are likely to.
Yeah.
Is the volume okay?
No.
You can use the mic. Because I mic didn't take us on. You can use it.
There's no space.
Then the speakers.
We can link it to the microphone.
You cannot link it to the microphone.
Is that you have kept Bluetooth is on.
Okay.
Just connect.
Can you put a Bluetooth there, Mancha?
Okay.
Put it on it. You're supposed to on it first.
Life is amazing with Ahmed. Bluetooth mode.
Secretary, our secretary.
Nigeria has remained very inadequate acts. Imagine a good farm.
What? Is it something? Yes. Did you got it? Okay. Okay. No, you need to go. You need to go and collect for us. Cool. Okay. Go. Jenny?
So we are set.
Okay. Yeah.
Losing half of its livestock due to a disease that can be prevented with a vaccine costing less than a cup of tea. This is not a fiction, this is the reality of Nigeria's farmer every day. Hi everyone, I'm by name Lukman Apara, a 600 level student of the Faculty of Veterinary Medicine, Ahmadu Bello University, Zaria. I would like to take us through a discussion on the role of private sectors in scaling ruminant vaccination across Nigeria. First and foremost, I would like us to know that Nigeria has one of the largest livestock population, which is estimated to be over 145 million. In this 145 million, we have about 20 million population of cattle, we have about 80 million population of goat, and over 45 million population of sheep. Yet, infectious diseases such as contagious bovine pneumonia, pesticides ruminant, lumpy skin diseases, foot and mouth diseases continue to cause reduction in productivity of these livestock due to poor access to veterinary services, inadequate cold chain facility, inadequate financing, and also the mobility of the livestock communities. However, vaccination remains one of the most effective ways of preventing these diseases. Yet, vaccination in Nigeria has remained very inadequate always because of poor access to veterinary services, inadequate funding, and also inadequate cold chain infrastructure. These conditions result in high fatality, causing high fatality of the livestock, and also causing reduction in weight gain and more other disadvantages to this livestock. Now the question one will ask is why the participation of private sector matters. This is a reality we cannot ignore. The government alone cannot provide vaccines to the enormous population of livestock across Nigeria's geography. That is why, looking at this reality, the Federal Ministry of Livestock and Development persistently emphasized that disease surveillance, vaccine delivery, and vaccination campaigns require strong public-private sector partnerships. Example of those private sectors that can partake in scaling ruminant vaccination in Nigeria can include veterinary pharmaceutical companies, vaccine manufacturers, veterinary agribusiness retailers, private veterinary clinics and veterinarians, and also financial institutions and insurance companies, and also transportation and cold chain logistic companies. These are all private sectors that can partake in the scaling of ruminant vaccination in Nigeria. Throughout my stay of study, I have strong interest for livestock healthcare because I believe healthy animals are essential for food security, economic growth, and source of livelihood to many farmers. Among the roles in which the private sectors can partake in is by one, expanding vaccine production through building vaccine manufacturing plants, improving research and innovation, developing locally adapted vaccines, thereby reducing dependency on imported animal vaccines and also reducing the cost price of these vaccines so that every farmer, even in underserved areas, can be able to get these vaccines. Another important function in which the private sector can carry out is strengthening vaccine distribution. Through what? Through refrigerated transportation, solar-powered cold storage system, digital temperature monitoring system, and many others. Another function in which the private sector can participate in is increased access to veterinary services. As we all know, Nigeria has a limited population of veterinarians that can serve the enormous population of livestock that we have in the country. So, involvement of this private sector can provide routine vaccination, reporting of disease outbreak, diagnosing of the diseases, and also farmer education on the prevalence and fatality of some of these diseases. And also, the private sector can also help in creating sustainable vaccination campaigns. Private sector can also help in many other aspects, including digital innovation and financing vaccination. So, to my conclusion, we have to know that Nigeria has millions of ruminants, yet many remain unvaccinated because vaccines do often fail to reach the last mile. The private sector has the innovation, technology, logistics, and the investment to be able to fill in this gap. Every naira invested in livestock vaccination helps to protect farmers' income, strengthen food security, and also reduces the risks of disease outbreak. The question is no longer whether the private sector should participate. The question is whether Nigeria can afford to achieve a nationwide ruminant vaccination without the private sector. Thank you very much.
GALVmed folder. Yes.
Good day, distinguished judges. My name is Salamin Asiya Unu.
a final year student of the Faculty of Veterinary Medicine at the Bello University, Zaria. Today, I'll be speaking on the topic, the role of the private sector in scaling ruminant vaccination coverage. Vaccine has never treated an animal when sitting on the shelf. It only saves a life when it reaches the right animal at the right time, in the right condition, and administered by the right person. Nigeria has one of the largest livestock populations in Africa, with over 55 million cows, 65 million sheep, and 139 million goats. And livestock contributes to about 21% of Nigerian agricultural GDP. Now, here's the interesting fact. Nigeria already has effective vaccines, trained veterinarians, research institutes like MVRI, and livestock vaccination programs. But why do disease outbreaks still occur? Vaccines don't stop disease, but vaccination systems do. Many farmers still struggle to access vaccines. Some communities are difficult to reach. Cold chain system fails and vaccination coverage remains low. So the real challenge isn't producing vaccines, it's delivering them. What prevents us from achieving high vaccination coverage? Several challenges work together. In many parts of Nigeria, pastoral migration and insecurity makes vaccination campaigning even more difficult. These systems are the problems, not the vaccine. This is where the private sector becomes important. Governments cannot do everything alone. The government provides leadership through regulation, policy, and disease surveillance. However, high disease coverage requires collaboration with the private sector. The private sector can invest in local vaccine production, veterinary equipment, cold chain infrastructure, and an efficient distribution system. The private sector can also strengthen service delivery. Private veterinarians can support government teams during mass vaccination campaigns, help identify livestock farmers, and expand access to veterinary services where manpower is limited. Another important contribution is digital innovation. The government and private sector can jointly develop digital platforms and disease reporting. Innovation can also solve another important challenge. Many livestock vaccines are packaged in large dose vials. For smallholder farmers, this increases cost and often leads to vaccine wastage. The private sector can innovate with packaging solutions while not being at loss. Private sector can also introduce innovative financing models. For example, vaccines should be provided at substantial prices through public-private partnership, making routine vaccinations more affordable for the owner. The private sector can produce vaccines locally and manufacture essential veterinary equipment and improving vaccine availability. Private logistic companies can strengthen cold chain systems and ensure vaccines remain potent, and create policies that attract private sector investments while reaching even remote pastoral communities. The third area is the veterinary service delivery. Private veterinarians can support mass vaccination campaigns, identify livestock farmers, and extend services to communities that government teams may not reach. Another important area is farmers' education. Many livestock owners are unaware of diseases like peste de petite ruminants and contagious bovine pneumonia. The private sector can also drive digital innovations. Rather than relying on paper records, digital platform or software as a system can be used to register livestock, record vaccinations, and report disease outbreak in real time. This allows the government to know which animals have been vaccinated, which communities have been missed, and where additional vaccines are needed. Finally, there is investment and financing. Private investors can strengthen vaccine production, storage facilities, and distribution network. They can also introduce financing models that makes vaccination more affordable. Through credit schemes, subsidized vaccines, or other innovative payment options for livestock owners. Evidence shows that these approaches works. In Nigeria, the collaboration among governments, the National Veterinary Research Institute, the Food and Agricultural Organization, and the veterinary professionals has strengthened PPR vaccination programs. In East Africa, community-based animal health workers have successfully reached remote pastoral communities. The lesson is simple. Strong partnerships leads to stronger vaccination programs. So what should Nigerians do? Strengthen public-private partnerships, invest in cold chain infrastructure, improve farmers' education, expand digital vaccination records, encourage innovations, and create policies that attract private sector investments. If we do this, vaccination coverage increases, disease outbreak decreases, livestock becomes healthier, farmers earn more income, food security improves, and Nigerian livestock sector becomes more resilient. Vaccines alone do not control diseases. No vaccination systems.
I am Muhammad a final year student of Veterinary Medicine from Ahmadu University, with a passion of integrating animal health and technology to solve problems of people in partnership to solve community problems while making money back. That is the reason why I observe over time that problems associated with the vaccine preventable diseases are majorly as a result of problem of cold chain, problem of low awareness, low vaccine coverage, and also vaccine awareness. All of these are incorporated on the basis of the problem. And that is why we come up with a solution of solving this problem, and that is a solar powered hub with drone delivery system incorporated. So in the system, we have a solar hub that will be in an institution, aligned to it, and then be offering vaccines to the institutions and the neighborhood. What is the mission of this solar power hub? The mission is to increase, improve, and also help in promoting livestock productivity in ruminant in Nigeria, and also the vision is to be one of the leading hubs, one of the leading business hubs in vaccine prevention and also delivery of vaccine in Nigeria and Africa at large. So the model is we obtain a vaccine from a reputable source. It uses this on solar hub. We store it for a particular time, send it through or deliver it through our drone system to farmers or to veterinarians, and then we have the data being reported back to us from the users. Another thing is the solar powered hub will serve as a direct source of vaccines and access to institutions, will also serve as a hub of vaccine to veterinarians, to veterinary paraprofessionals, students, and also researchers. The solar hub will also serve as a system of a small micro enterprise model. The drone delivery system will be a fast delivery system that will reduce the time of the vaccine in transit, and also will have a better reach to different communities. The drone system will have a software that it will run on. The community will be engaged through training of veterinary paraprofessionals, the veterinarians, and also other community animal health workers through training and also awareness campaigns, and also the networks that we will create with them. Therefore, the opportunity as being reported in 2021 is Nigeria has 152 million, I repeat, 152 million livestock ruminants. That is how large the numbers is in Nigeria. And therefore, in terms of the business model, the business targets farmers, veterinarians, paraprofessionals, institutions, and so on. And also, we make money through vaccine sales and vaccine delivery majorly. Also, the business will only spend money in terms of vaccine stocking, maintenance, staff salaries, tax, and rentals where applicable. The business became feasible considering the technical feasibility, the organizational feasibility, and also the legal and regulatory framework, while also considering the financial aspect, which is 100% planned to be sourced from partnership. The team is composed of 3 individuals: the CEO, the CTO, and then the marketing and the sales intelligence. the business will strictly comply, adhere to all rules and regulations of Nigeria and also the rules and regulations of other institutions relevant to biologics and also drugs and other substances. The planning for implementation is a fourth main major thing: the planning stage, the installation stage, the drone pilot, and that's all. Thank you for listening.
A very good day to everyone looking at me, listening to me, and watching me this moment. My name is Manuel Taiwo, UAT 006 from the Faculty of Veterinary Medicine, Ahmadu University, Zaria. And very briefly, I will be speaking on the role of the private sector in scaling ruminant vaccination coverage in Nigeria. By way of introduction, livestock production is actually a very, very critical pillar of Nigeria's agricultural economy, food security, and rural livelihood. Especially small ruminants, as they actually they play essential role in poverty alleviation and asset building. But unfortunately, productivity and economic potential of this particular sector has been severely undermined by transboundary animal diseases such as PPR, CCPP, CBPP, FMD, and the likes of them. Although government has tried, to hamper or to actually ensure this coverage, but in a way they've not been able to really achieve herd immunity, and that's just because of some problems such as logistical bottlenecks, such as cold chain breakdowns, mobility deficits. Also, there's also budgeting constraints, and examples just maybe delayed fund releases, donor dependency. Also, there's also the security vulnerability factor. Banditry and insurgency. They've kind of hamper veterinarians to be able to go into these localities. Rural areas where these animals are actually there in their population.